Hi, I'm Heidi. I work in the maxillofacial prosthetics department at Poole Hospital. We're based in the outpatient department and we see patients from the whole of the Dorset area. We provide a wide range of custom-made medical devices. These could be for a simple mouthguard type device to help with jaw pain or surgical planning for jaw correction procedures. We also make more complex facial prostheses which can be held in place with medical adhesives or titanium pins similar to dental implants. We are part of the healthcare science specialty and are also known as reconstructive scientists. Our role is scientific, technical as well as clinical. So here we can see we're doing a colour match for a skin, and here we use tiny little fibres of flockings to enhance the colour of a prosthesis. You can see it just brings the colour of the silicone to life just by adding tiny little bits of colour. So here we've got again a darker colour for the shadow of a nostril area here. And we would do this in the clinic with the patient initially, and then we have a record of the patient as well. But usually we'll sit with the patient and it'll take about an hour to do a colour match for a patient. And here you can see the mould. Once the prosthesis is carved in wax, it's then created into a stone mould. Here you can see the magnet retention, which goes on to some implants that are in the bone of the patient. And this will then click into position on the mould, and then the silicone goes into the area where the wax was. It's called the lost wax process. And this then creates the silicone prosthesis, and that gives the replica of the wax carving that we have. We also support patients with prosthetic fingers as well. So here's the example here with an acrylic nail on here as well. And this is some of the staging process. So here is a wax pattern. And you can see just some adjustments that we're making here compared to the previous one that was made. And this is the type of mould again that we make the prosthesis in. We assist with various planning stages for surgical procedures, and when required we also attend theatres to support the surgeons. The designing and planning is carried out on plaster models or with the use of specialist CAD/CAM software and 3D printing. Our role utilises so many skills we find that no 2 days are the same. The patients we see have a visible difference. They may have been born without an ear, for example, or been through trauma or undergone treatment for cancer. We support these patients with a full range of professionals, including the surgeons, specialist nurses and speech and language therapists. This team approach gives the best patient-centred care possible.
Hi, my name's Sian and I'm a maxillofacial prosthetist. We're now going to take you through the basic stages that we follow to make a facial prosthesis. Impressions are taken with silicone so that we can make working models. Stone is poured into the impressions to get a copy of the patient's anatomy. We then design the method of holding the prosthesis in place.
The cast of a model with 2 titanium pins here, how it represents on the patient, and here you can see the magnets in the prosthesis, and that clicks into place.
The wax shape is tried and adjusted in the clinic with the patient. When it's ready, a mould is made so that we can convert this wax into silicone, and wax is shaped to replicate the missing anatomy. Silicone is mixed with pigments and little tiny fibres to match the skin tone and fine details of the skin. These individual colours are carefully placed into the mould to give lifelike effects that replicate the skin texture. Putting in these localised colours, they break up the final effect, so it's not just one flat colour, which makes it look much more lifelike. We can put in stronger colours like this tan colour, and we can mimic things like freckles or moles. The material is cured to process the prosthesis. Additional details can be added to enhance the result. These are things like extrinsic colours and eyelashes. The whole process is a mixture of technology, art and science. A prosthesis will last anywhere from 6 months up to about 2 to 3 years, and this depends on how often they're worn. The outcomes can be life-changing for the patient. Patients are then seen at regular review appointments, and we build a close working relationship with them as time goes by, because they're with us for as long as they continue to wear their prosthesis. I enjoy the variety in the work that we do. The precision needed for surgical planning, as well as the creativity needed in planning and making our facial prosthetics.
Our role has a huge impact on somebody's quality of life. They've already been through so much and we feel incredibly fortunate to make such a difference. We're able to increase their well-being by boosting their confidence and helping them to get on with their everyday life. I love my job. It's such a rewarding career and it makes a real difference to people's lives.
Our job has a positive impact on all of our patients, and every day really is different.